So a question that I bet a lot of people are thinking about, when it comes down to it, when do you guys think the vaccine will actually be available for the general public and like kids and teenagers?
It's really all about what we call a prioritization with the supply that we have. So, and the vaccine is really being managed from a federal to state level, and then we are following that guidance as hospitals and clinics here in Idaho. So the prioritization has there's in Idaho there's a vaccination task force, and one of our colleagues, one of the physician colleagues that works with us is on the task force, several actually, and they've really gone through and prioritized. When we get a certain amount, this is where it should go first. When we get another amount, this is where it should go. And as you might imagine, that's done in best faith effort, right? To get vaccine to those who are taking care of the sickest of COVID patients first, then taking care of those who are at the highest risk of, if they were to get COVID, they perhaps might not do so well. And that might be some of the elderly with significant medical conditions. And then from there out onto the general public, and to try to get that out. So we think it's going to be some number of weeks or months till it's widely available. And then for you as students, really the next step is going to be approval, more vaccinations coming out, and then approval for pediatric patients, which I think, Kenny can probably speak to with more expertise, but from his stance. But right now the vaccinations have really been approved for adults initially, with the intent to in the future, offer them to children.
The first vaccine that got here already is the Pfizer vaccine, and that's been approved for patients who are 16 and older. The next vaccine that actually we just approved at St. Luke's this morning is the Moderna vaccine, and they're both a type of vaccine called mRNA vaccines. That one has been approved, I believe, for age 18 and older, and they are studying the 12 to 18-year-old group.
Yes.
One of the strange things that I'll share with you about almost every medical therapy is, first we try it in healthy adults, then we try it in sick adults, then we try it in pregnant adults, and at the very end, then we try it in children. So particularly the young children are the ones who will probably have to wait the longest.